Imagine this for a moment. Two numbers quietly appear on the blood pressure machine. One is high, the other looks normal. Your doctor circles just one of them, but which one actually puts seniors in more danger? Many older adults focus on the wrong number, and that mistake could slowly damage the heart, brain, and kidneys without any warning signs. As we grow older, blood pressure becomes more than just numbers on a screen. It becomes a story about how hard your heart is working, how flexible your blood vessels are, and how much risk you carry for stroke, heart attack, or memory loss. Most seniors are told they have high blood pressure, but very few truly understand which number matters most and why it matters so much after the age of 60. Blood pressure is always written as two numbers. The top number is called systolic pressure. This is the pressure inside your arteries when your heart squeezes and pumps blood forward. The bottom number is called diastolic pressure. This is the pressure when your heart relaxes between beats. For many years, doctors believed the bottom number was the most important. Seniors were often told, as long as your lower number is fine, you're okay. But modern science has completely changed that understanding. As we age, our arteries naturally become stiffer. In younger people, arteries are soft and flexible, expanding easily with each heartbeat. But over decades, calcium buildup, inflammation, and wear and tear cause them to harden. This stiffness makes the systolic number rise, even if the diastolic number stays normal or even drops. This condition is extremely common in seniors, and it's called isolated systolic hypertension. Here's the danger: many older adults see a diastolic number like 70 or 75 and feel reassured. They think, my lower number is good, but at the same time, their systolic number may be 150 or 160, quietly putting enormous strain on the heart and blood vessels. This high pressure during each heartbeat can damage delicate organs little by little, without pain or obvious symptoms. Studies following tens of thousands of seniors over many years have shown something alarming. High systolic pressure is a stronger predictor of stroke, heart failure, kidney disease, and even cognitive decline than diastolic pressure in older adults. In simple terms, for seniors, the top number usually carries more danger than the bottom number. But this does not mean diastolic pressure doesn't matter at all. If it drops too low, it can reduce blood flow to the heart itself, especially in people with coronary artery disease. That's why balance is critical. The goal is not just lowering numbers, but lowering the right number safely. Many seniors ask, why do I feel fine if my systolic pressure is high? The reason is simple. High blood pressure is often called the silent killer because it doesn't cause pain until serious damage has already occurred. A person can feel perfectly normal while their blood vessels are under constant stress every single day. This is why understanding these numbers is so important. It gives you control. When you know which number deserves more attention, you can ask better questions, make smarter lifestyle choices, and work with your doctor instead of feeling confused or afraid. When systolic blood pressure stays high over time, it doesn't just stress the heart, it slowly changes the entire circulatory system. Each heartbeat becomes like a stronger racing against stiff pipes. The heart has to push harder to move blood forward, and over the years, this extra effort causes the heart muscle to thicken. At first, this seems like strength, but in reality, it makes the heart less efficient and more prone to failure. For seniors, this process is especially dangerous because aging blood vessels don't recover easily. High systolic pressure damages the inner lining of the arteries, creating tiny tears that invite cholesterol and calcium to settle in. This buildup narrows the arteries and increases the risk of clots. When a clot blocks blood flow to the brain, a stroke occurs. When it blocks blood flow to the heart, it leads to a heart attack. This is why doctors focus so heavily on systolic pressure in older adults. The brain is another silent victim. High systolic pressure can damage small blood vessels deep inside the brain, reducing oxygen supply over time. This doesn't cause immediate symptoms, but years later it can appear as memory loss, difficulty concentrating, or even vascular dementia. Many seniors think memory decline is a normal part of aging, but in many cases, uncontrolled systolic blood pressure is a major contributor. Now let's talk about diastolic pressure. In seniors, diastolic pressure often stays the same or even decreases as arteries stiffen. When it falls too low, especially below 60, the heart may not receive enough blood during its resting phase. This can cause dizziness, fatigue, or chest discomfort, particularly in people with existing heart disease. So while systolic pressure is usually the bigger danger, diastolic pressure still matters. This is why modern guidelines for seniors focus on pulse pressure, which is the difference between systolic and diastolic numbers. A large gap between the two often signals stiff arteries and higher cardiovascular risk. For example, a reading of 160/70 is more concerning than 140/90 in many older adults, even though the lower number looks better. One of the biggest mistakes seniors make is ignoring high systolic pressure because they feel fine. blood pressure damage happens slowly and quietly. By the time symptoms appear, significant harm may already be done. That's why regular monitoring at home and understanding trends over time are far more important than one occasional reading at the doctor's office. The good news is that systolic blood pressure responds very well to lifestyle changes, even later in life. Gentle daily walking improves artery flexibility. Reducing salt lowers pressure inside blood vessels. Managing stress calms the nervous system and prevents sudden spikes. Even small improvements can dramatically lower the risk of stroke and heart disease. For many years, seniors were told that a systolic pressure 150 or even 160 was normal for your age. Doctors believed lowering it too much might be risky. But large, long-term studies have shown something very important. Most seniors benefit from bringing systolic pressure down as long as it's done carefully and gradually. Today, many experts agree that for healthy older adults, a systolic pressure below 130 or 140 can significantly reduce the risk of stroke, heart failure, and kidney damage. However, this target is not the same for everyone. A frail senior or someone who feels dizzy when standing may need a slightly higher target to avoid falls. This is why personalizing blood pressure goals is so important in older age. Diastolic pressure, on the other hand, should generally not be pushed too low. For most seniors, keeping it above 60 is important to ensure the heart gets enough blood during rest. When doctors treat high systolic pressure, they must watch the diastolic number closely to avoid overtreatment. This delicate balance is one reason why seniors should never adjust medications on their own. Another key factor many people overlook is timing. Blood pressure naturally rises in the morning and falls at night. In seniors, a sharp morning rise in systolic pressure increases the risk of heart attack and stroke in the early hours of the day. This is why consistent sleep, stress control, and proper medication timing can be just as important as the medication itself. Home blood pressure monitoring gives seniors a powerful advantage. Checking blood pressure at the same time each day, sitting calmly, and keeping a simple log helps reveal patterns that a single clinic reading can miss. Many seniors are surprised to discover that their systolic pressure spikes during stress or after salty meals, even when they feel perfectly fine. There's also a strong connection between blood pressure and everyday habits. Dehydration can raise systolic pressure by thickening the blood. Poor sleep can keep the nervous system in a constant state of alert. Even loneliness and chronic worry have been shown to raise blood pressure over time. In seniors, caring for emotional health is not optional, it's part of heart health. Perhaps the most empowering truth is this: arteries can improve at any age. They may never return to youthful flexibility, but they can become healthier. Regular movement, balanced meals rich in potassium, and steady routines help reduce pressure inside the vessels. These changes don't work overnight, but they work reliably. One of the most common myths among seniors is the idea that blood pressure only matters when it causes symptoms. Many believe that if there's no headache, no chest pain, and no dizziness, then everything must be fine. In reality, high systolic blood pressure can quietly damage the body for years without causing any discomfort at all. By the time symptoms appear, the damage is often advanced. Another myth is that lowering blood pressure always makes seniors weak or tired. While overtreatment can cause problems, properly managed blood pressure usually improves energy over time. When the heart doesn't have to fight against high pressure with every beat, it works more efficiently. Many seniors report clearer thinking, better sleep, and improved stamina once systolic pressure is brought under control safely. Some older adults also believe that medication is the only solution. While medication can be life-saving, it works best when combined with daily habits that support healthy blood vessels. Simple routines like walking after meals, breathing slowly when stressed, and limiting processed foods reduce pressure naturally. In many cases, these changes allow doctors to use lower doses of medication, reducing side effects. There's also confusion about normal readings at the doctor's office. Anxiety can temporarily raise systolic pressure, a phenomenon often called white coat effect. This is why home readings are so valuable. If systolic pressure is consistently high at home, it's a real concern, even if clinic numbers sometimes look better. For seniors, consistency matters more than perfection. A single high reading doesn't define health, but a pattern of elevated systolic pressure does. Tracking trends over weeks and months gives a far clearer picture of risk than focusing on one day's numbers. Perhaps the most important thing for seniors to understand is that blood pressure control is not about fear, it's about protection. Protecting the brain from stroke, protecting the heart from failure, protecting independence and quality of life. Understanding that systolic pressure is usually the more dangerous number after 60 helps seniors take action early before serious problems develop. When you step back and look at the full picture, one message becomes very clear for seniors. Both blood pressure numbers matter, but after the age of 60, the systolic number is usually the more dangerous one. It reflects the stiffness of the arteries, the workload on the heart, and the long-term risk to the brain and kidneys. Ignoring it simply because the diastolic number looks normal can allow silent damage to continue unchecked. At the same time, wisdom is required. Lowering systolic pressure should never mean pushing diastolic pressure too low. The goal is balance, not extremes. This balance is achieved through careful monitoring, thoughtful lifestyle changes, and working closely with a healthcare provider who understands the unique needs of older adults. Knowledge gives seniors power. When you understand what those two numbers truly represent, fear turns into clarity. You're no longer guessing, no longer assuming, and no longer ignoring warning signs. Instead, you're making informed choices that protect your heart, your mind, and your independence. Small daily actions add up. A calm walk, a mindful meal, a moment of deep breathing, a good night's sleep, these are not small things for blood pressure. Over time, they gently reduce systolic strain and support healthier arteries. Even in later years, the body responds to care. High blood pressure does not have to define aging. With awareness and consistency, many seniors live long, active lives while keeping their numbers in a safer range. Understanding that systolic pressure is often the bigger threat is the first step toward prevention, not panic. Imagine this: you sit down at the doctor's office, and the nurse wraps the cuff around your arm. The numbers pop up on the screen. One is high, the other looks normal. You feel relieved, but should you? Which of these numbers is truly more dangerous for seniors, the top one, the bottom one, or both? This choice could quietly affect your heart, your brain, and even your independence over time. Blood pressure is always written as two numbers: the top number, called systolic, and the bottom number, called diastolic. Systolic pressure is the force of blood against your artery walls when your heart beats. Diastolic pressure is the force when your heart rests between beats. For decades, many people focused on the bottom number, thinking that as long as it was under 80, they were safe. But modern research shows that in older adults, the top number usually carries more hidden danger. As we age, our arteries naturally stiffen. In younger people, arteries expand easily with each heartbeat. But over decades, calcium deposits, inflammation, and general wear make arteries less flexible. This stiffness pushes the systolic number higher, even if diastolic stays normal or drops slightly. This condition, called isolated systolic hypertension, is extremely common in seniors. Here's why it matters. Many seniors see a diastolic number like 70 or 75 and feel reassured. Meanwhile, their systolic number may be 150 or higher, quietly stressing the heart, brain, and kidneys with every single beat. High systolic pressure is linked to stroke, heart failure, kidney disease, and even cognitive decline. The scary part is that it often causes no symptoms until serious damage has already occurred. That's why it's called the silent killer. Diastolic pressure is still important, too low, and the heart may not get enough blood during rest, which can lead to dizziness or chest discomfort, especially in people with heart disease. But for most seniors, systolic pressure is the bigger risk factor, and monitoring it closely can mean the difference between prevention and serious complications. The good news is that systolic pressure responds well to lifestyle changes. Even in later years, walking, reducing salt, managing stress, staying hydrated, and maintaining good sleep patterns all help arteries remain healthier and reduce strain on the heart. Simple, consistent actions can make a huge difference in protecting seniors from dangerous outcomes. Understanding safe blood pressure numbers for seniors can be confusing because one size does not fit all. For healthy older adults, most experts now recommend keeping systolic pressure below 130/140. But this isn't a strict rule. Frail seniors or those who feel dizzy when standing may need slightly higher targets to avoid falls. The key is balance, lowering the top number without letting the bottom number drop too low. Monitoring at home is essential. Blood pressure naturally rises in the morning and can spike during stress or after salty meals. By checking it at the same time each day, seniors can see true trends instead of relying on a single reading at the doctor's office. Keeping a simple log helps detect patterns early, giving both patients and doctors the insight needed to adjust lifestyle or medication safely. Lifestyle plays a huge role. Gentle daily activity improves circulation and flexibility of arteries. Reducing sodium, eating more potassium-rich foods, staying hydrated, and managing stress all help control systolic pressure. Even social connections and mental well-being have measurable effects on blood pressure over time. A calm, consistent routine is as powerful as any medication. It's important to dispel myths. High blood pressure rarely causes immediate symptoms, so feeling fine doesn't mean everything is safe. Conversely, lowering blood pressure gradually under guidance usually increases energy, improves sleep, and enhances overall well-being. Knowledge and awareness empower seniors to act before damage occurs, rather than reacting too late. By focusing on the systolic number and understanding how diastolic pressure also contributes, seniors gain control over their health. They learn which numbers deserve attention, how daily habits influence readings, and why early prevention matters more than quick fixes. Awareness, regular monitoring, and balanced lifestyle choices create a protective shield for the heart, brain, and kidneys. High blood pressure does not have to define aging. With informed action, seniors can live long, active, and independent lives while keeping their blood pressure in a safer, healthier range. Understanding the greater danger of systolic pressure is the first step towards smarter decisions, stronger health, and peace of mind.